Welcome to the Lakeview Health podcast series. My name is Sarah Kovach, and I'm the clinical manager at the Rose, the Women's Center here at Lakeview. And joining us today is Dr. Schneider, the lead therapist at Castlewood and the adjunct faculty at St. Louis University. So today we're talking about trauma and eating disorders. Thank you, Dr. Schneider, for being with us today.
Thanks.
So, Dr. Schneider, you just gave us an incredible lecture series this morning on eating disorders and trauma. Can you give us a little bit more information about specifics that you've seen in the field?
Yeah, I mean, I think, what we were able to talk about, it was a great crowd, is the impact that trauma can have on eating disorders. And, we talked about that there isn't a causal factor between trauma and eating disorders. And so we can't say trauma causes eating disorders, but we do know that childhood trauma and other types of trauma are a significant risk factor to eating disorders. And so being able to look at the underlying trauma is essential for being able to work towards symptom reduction. So for specific examples, it may be that somebody who's experienced sexual assault tries to manipulate their body through the eating disorder. So for instance, in this case of restriction, if I am underweight, then people won't find me desirable. The same thing with binge eating disorder. If I keep my body at a certain overweight piece, then maybe nobody will find me desirable and I won't be sexually assaulted again. Would be some examples of how you could use it.
Mm-hmm. So, Dr. Schneider, what drew you to Castlewood and their specific treatment program?
Yeah, I think, there are obviously lots of different treatment models out there for eating disorders. None of them are great. None of the empirically supported things are great. And we use each of the empirically supported techniques at Castlewood, but it's clear that we need to figure out other things to do. And one of the things that I think is really difficult is the pathological nature of many of the treatment models that we have. And so Castlewood, coming from an attachment base and interpersonal neurobiology, takes a developmental pathway to understand the eating disorder as is not something we need to be in a power struggle, but is an adaptive coping strategy or maladaptive coping strategy that helps us understand why it came to be. And once we can understand the function, we can work towards doing things in a more adaptive way and meeting that need.
Mm-hmm. So as a teacher, what are most of your students studying? What are they wanting to pursue after graduation?
It's interesting. I teach in a couple of different programs, but when I teach training counselors, very typically they have a passion for change. They know they want to make a difference. Sometimes they have a specific population they want to work with. Many times not. They just know they want to create change. And so it's this great time of them trying to figure out what model of therapy fits best, what this looks like, and what change can actually occur. And so it's pretty exciting. I, of course, given my bent, most of my classes take a developmental trauma framework from attachment theory, interpersonal neurobiology. But always open to them developing their own form of therapy that fits for them.
Can you tell us how patients at Castlewood learn to develop healthy personal relationships, learn to manage addiction and eating disorders?
Yeah, one of the big tragedies of the eating disorder is it pushes people away at the time you need them the most. And so the eating disorder does this what feels like adaptive at the time of teaching people how to soothe without needing to rely on others. And so many times relationships suffer greatly because of either the manipulation in the eating disorder or the isolation that happens in the eating disorder or other addictions and other behaviors. And so much of what we do is an attachment-based program is try to figure out how to have intrapersonal attunement and sort of understand themselves better and be able to have a better sense of self-agency around managing their own emotional process, and then also being able to interpersonally attune to others and how attachment strategies play out that end up inadvertently pushing people away at the time, again, when they need them the most.
Mm-hmm. So if people wanted to learn more about Castlewood, how could they do that?
Well, so the main way is through our website, castlewoodtc.com. There's plenty of information there about our facility. It's gorgeous. You should look at it. There's also webinars, so you can get to know the staff not only through their pictures, but also on what we present about, what we're looking, what we're researching, that sort of thing. Or the intake number, and I have to write it down because I don't call it, is 1-866-371-1874. And that's also on the website.
Excellent. Thank you so much for taking the time to talk to us today.
Thank you.
So if you're interested in learning more about Lakeview, you could also go on our website at lakeviewhealth.com or contact us 24/7. We have people available at 866-887-0142.